All right, let's turn our focus to this now. The South African Medical Association says it's concerned by the high number of alcohol-related admissions over the festive season. They say the increased alcohol consumption is putting a strain on hospitals as it leads to a surge in admissions at emergency units, causing a strain on healthcare workers and other healthcare resources. Adding to that, it delays care for patients with medical emergencies. Well, joining us via Teams is Dr. Zanele Bikitsha, Vice Chairperson of the South African Medical Association, or SAMA, and we also be joined virtually by the JMPD's Xolani Fihla. Ma'am, a very good afternoon. In fact, a good afternoon to you both. Let me start with you, Dr. Bikitsha. From a medical perspective, I mean, how severe has the spike in alcohol-related admissions specifically been this festive season, especially when you compare it to previous years?
Good afternoon. I think we are in the afternoon. We must say that it's always a joke about the festive seasons that we do tend to get, a spike when it comes to alcohol-related trauma in our casualties. In terms of stats, I won't lie, we actually happened to see quite a lot during the COVID, and I think that was because of the banning, so it kind of made it an illicit substance, but it still puts our trauma numbers at the highest that they are the whole year through. So your December would be second only to your Easter holidays and things like that. So December always happens to be one of our highest when it comes to trauma and alcohol related. So you must remember that includes, actual physical assaults where people are stabbing each other, hitting each other with bottles. It involves drunken driving charges. It involves domestic violence that is induced by alcohol. So this is definitely our peak season.
Yeah, and Xolani, let me bring you into this conversation. Just from a JMPD's perspective, what trends are you seeing on the roads and in the public spaces linked to alcohol consumption, particularly in terms of also what we're hearing from Dr. Bikitsha?
Good afternoon to you, and also to the panelists, or the good doctor, and to the viewers. Of course, we know that drunken driving, it has been proven. It is one of the biggest causes of serious and fatal accidents that we do see on our roads. And one thing that we do see is the complacency of our residents and the public on thinking that drinking and then getting behind a steering wheel is either cool, or I can handle it at that moment, or I won't be stopped and I won't be arrested, or I could pay a bribe to get away with it. But at the end of the day, it's not condoned. We know the consequences of that, besides the legal repercussions of either being arrested, having a criminal record, or facing a fine, or having your license revoked. Person can be involved in a serious accident or lose their life, and that's a definite concern for us as the JMPD.
Yeah, and Dr. Bikitsha, I want to just go back to some of, the statements that you made in terms of the strain. What kind of cases, during the holiday seasons, particularly the festive seasons, are dominating emergency units? I mean, whether it's violence, alcohol poisoning, or even, chronic complications. And I want to also look at systemically, what does that strain do, to the health system as a whole? And how does that put a very busy, I would imagine, emergency service under even more strain?
Yeah, okay, so let me start with the common things that you do see in December. You see a lot of your trauma. And with your trauma, like I reiterated earlier, that's stabbing, that's your gunshots, it's your motor vehicle accidents, it's your domestic violence, it's all the trauma kind of stuff that you're seeing a lot of during the peak season in December. And unfortunately, it's as a result as well that people only come for those kind of things. People default their appointments for their chronic illnesses
Yeah.
in December. The other kind of conditions that you do see
Dr.
is,
Dr.
your
Bikitsha,
chronic.
Dr. Bikitsha, let's take it where you left off. You were painting a picture of just the systemic strain in the emergency units in hospitals over the festive period, and perhaps also give us a sense beyond the numbers what toll this is taking on healthcare workers who are already operating under extreme pressure.
Yeah, so I was saying to you that December ends up being a lot of trauma. And with trauma, it's emergency cases. So it's kind of cases that you've got to deal with here and now. Now, you have a problem in the sense that I'm sure you're aware there's been a cry about the shortage of doctors that are around, but it's not only doctors, nurses, and other clinicians. So when you also have that shortage, just the other week, I was interviewing about specialists also exiting the public sector. So it puts pressure on those that are within the system to be able to manage this caseload that is suddenly influxing in December. You also have your co-partners, which is your ambulance services, which also need to come on board, and they also have limited, capabilities. So transporting patients from scene to the hospital, all of that becomes a huge pressure because we are greatly under-resourced. And you will also find that certain patients, especially because these are like your high velocity, like your accidents, these are specialist injuries, like maybe where there is like stabbing and vessels are involved. Those need specialist institutions. You can't just perform those surgeries in a district hospital. So we've got a lot of pressure on us during this December with the understaffing, with the infrastructure at those bases, and also support services. So it becomes quite gruesome for everybody that is actually on the ground, not only for the doctors, but for other clinicians as well. And you end up with staff that are overworked, that are fatigued. Most hospitals now don't even allow junior staff to go off after the 15th
Yeah.
because otherwise we just won't be able to cope.
Yeah, Xolani Fihla, how stretched are law enforcement, resources during the festive season? I mean, particularly around drunk driving, as well as illegal alcohol sales that we've seen authorities destroy also over the festive season.
It does become really stretchy, especially for law enforcement in various areas, not only in the city of Johannesburg, but I can say in the whole province of Gauteng. Fortunately, with that stretch, there has been some cooperation and collaboration with various other law enforcement agencies operating within the city, as Gauteng Traffic Police, National Traffic Police, and a greater extent as well as the South African Police Services. And with all these entities, we can make arrests for driving under the influence of alcohol, and then, of course, then handing it over to the South African Police Services. But moving further with that, of course, with the sales and operation of sites which are illegally operating or operating contrary towards their licenses or permits. We have been checking that as well with the South African Police Services, and especially over the crossover into the new year, where we headed into areas like Maboneng, where they were operating contrary to their licenses, and ensuring that people are then dispersed out of those areas, and then the place is shut down. The owner is then given a fine, and then for them to then open up their places of entertainment need to adhere to that. But moving forward, at the end of the day, it is a shared responsibility, and not only through law enforcement or government, if I should say, but the residents also have to play the part, the citizens have to play the part in ensuring that we do curb any scourges of people dying on our roads.
Yeah, and I'm glad you answered that question about collaboration. But, Dr. Bikitsha, just listening to what Xolani Fihla is saying, I want us to wrap up this conversation with exactly those sentiments. I mean, it does seem to be a cycle we repeat every festive season: high alcohol intake, overwhelmed hospitals, exhausted police and medics. What will it take then to break this cycle?
It's a multidisciplinary approach that you need here. So with us, and I'll talk about Xolani because now we're talking at our level. We have what you call your Tutuzela centers, where they would then, once they've got those roadblocks, they then bring the people there. We do alcohol blood draw, we do drug testing, and also if they do have, criminals, we bring them on site. So we are working together in that type of a fashion with law enforcement. But we are all strained in the sense that there aren't enough Tutuzela centers, there isn't enough police, and definitely not enough doctors to sustain that kind of a service. We also deal with rape victims with them. So we do have good collaboration with law enforcement. But it goes beyond that. We also need to go to where the root of the problem is, and that is going into the youth, because that's where it starts, going into the homes where they are seeing it as a norm. So you cannot have, like for instance, we're having teenagers. We just had a 14-year-old delivering this Christmas. It shows that we as professionals need to start it at the root. But we definitely are working together with law enforcement to make sure that we're capturing it wherever it is. We just unfortunately are very constrained in our resources.
All right, so thank you so much to you both. I do appreciate your time. Of course, that was Dr. Zanele Bikitsha, Vice Chairperson of the South African Medical Association, or SAMA, as well as the JMPD's Xolani Fihla.